I'm Kayla from Walkie, Talkie Speech Therapy. Please subscribe as I'm posting new videos weekly. I recently posted a video on how to deal with aggressive behaviors, and today we're talking about how to deal with biting and what specifically could be causing biting. I'm going to talk about 4 common and not so common reasons for children to be biting. So let's get into it. I'll give some tips along the way for how to deal with that, or for what kind of resources to look into. Number 1 for aggressive behavior was be proactive. Find out, why are they biting? What is happening right before that causes it? What's that common thread, so that we can avoid that or change that to be proactive and avoid more biting in the future. The main reason for biting is they're frustrated, right? They're frustrated because they can't talk. And so that's one thing. So we're dealing with the frustration, and we're doing our best with that, of course, and we're trying to teach them signs and words. And as our signs and words continue to grow, their biting behavior should decrease. So frustration is most common, but anxiety could be another reason that your child is biting. So even though these guys are itty bitty, they really do soak in the emotions that are in their environment. So if there's a lot of anxiety in their environment, they're going to soak that in and they're going to feel it. And they're little, so they're not talking, most likely, right? Because you're working with me. So they're not able to express, they're not feeling good, they're not feeling safe or secure in their life at this time. So it often comes out in things like biting. So think about what's going on in your family's life and what might be causing anxiety. Some common things for anxiety, they're just big stressors. The top stressors in life are things like moving houses can be a stressful thing. Parents changing jobs, that's a naturally stressful thing, and your child might be picking up on some of that stress, as well as things like relationship issues, divorce, sickness. If those things are going on, maybe there's a death in the family and you're prepping for a funeral, those are life things and unavoidable, they happen, but your child may be feeling that anxiety and maybe expressing it in the biting. So think about what's going on and think about how you can help support your child in the stressful times of your family's life, as they will always come and go. Another one is teething. Super common, right? All kids go through teething. For some it's worse, and for some it's not so bad. You can talk to your dentist, of course, about suggestions, but I have some links and some natural pain reducers. I haven't tried them personally, but I hear good things about them, so look at those links that include things like essential oils and some of those amber bead necklaces and bracelets that are supposed to reduce pain. So that's one thing. There is baby Tylenol and things like that they sell at the store, so you can talk to your doctor, talk to your dentist for their recommendations on those kinds of medications or ointments, okay? But teething, let's talk about some other things that can help with teething, okay? So using a cold popsicle, that cold numbing sensation can help, okay? It can be a little small popsicle, and it can be a fun treat, and maybe that'll help soothe your child's teething. Also, maybe biting an apple, biting into a big apple, okay? Maybe they just need that just to really get in there, right? And feel something in their mouth. So maybe give that a try. Of course, supervising that, of course. Now, a 4th reason may be that they are what we call in the field sensory seekers. They may be experiencing something that in their body just is a need for more sensation, and that's why they're biting. And now this would be more for children who are biting all the time, and they're not just biting other people, they're biting themselves, and they're biting objects, and they're biting their clothes, and it's just kind of a constant thing, and you've ruled out the other options. So if this is happening, it's really a common problem, and especially if they're biting themselves, then we want to look into maybe some sensory integration issues, okay? This is very, very common in children with autism to have a sensory integration disorder, or to have special sensory avoidances or seeking behaviors. And so But many children have these kinds of sensory needs and do not have autism. So these sensory needs and the biting does not equal autism. It just is very common in children with autism. So again, if you're seeing a lot of this behavior and you're really concerned about it, I recommend talking to an occupational therapist about this. They really specialize in sensory integration, okay, sensory needs. So you can get a referral from your pediatrician. You can often get a referral from a speech language pathologist if you're already working with one, like myself. If you're working through the regional center, your service coordinator can help set you up, but an occupational therapy evaluation for constant biting of others and self and items may be warranted if that is going on. One last tidbit is if your child is grinding their teeth all the time, either during the night or during the day or both, and you can really sometimes you know because you can hear the sound of the teeth grinding. Okay, now that may be anxiety, even adults. I sometimes grind my teeth at night, and my dentist has talked to me about that, and it is usually stress and anxiety related. But talk to your dentist or your pediatrician about the grinding, if grinding of the teeth is going on with your child too. Okay, so I hope you found this video helpful. Feel free to post a comment with extra questions for me, or if you have other resources, please share them, and look forward to some more videos from me in our Walkie Talkie YouTube channel. Thanks so much, and please subscribe.